As of March of this year, the parish, St. Tammany Parish, bought this facility, and it is all ours. All you see is ours. We have great plans for Safe Haven, and we'll be talking more about it. We will sell the hospital, the mental health hospital, behavioral health hospital, to an operator, and they will continue their operation. But the other areas, oops, I'm lost. No, the other areas that are around here, we will bring other services in that will help enhance what is already being done out here. We have great plans, and you're going to be hearing a lot more about them. But I did want to ask if Senator Donahue would like to speak, and certainly Senator Vitter is here too. So, Senator Donahue.
Thank you very much. It was kind of a bleak day today. We heard that they were closing this facility. We didn't have any previous knowledge about it, and all of a sudden have this facility closed. You know, it's thanks to the leadership of President Brister that we were able to bring teams together from across the parish to get something done. It was interesting. We were explaining that to Senator Vitter. He said, "Boy, that's really making lemonade out of lemons." And then he reflected for a moment and said, "We have a lot of lemons in Louisiana we can work with." So hopefully we'll see some more good things coming out of Louisiana. Thank you very much.
Thank you, Senator.
Thank you, Pat and Jack, and all of you for the invitation to tour. I've really been looking forward to this visit very much. And first, I want to compliment all of the folks behind me and other partners who aren't here who made this smooth transition and this exciting new vision for a Safe Haven campus, who are making it a reality. It is a team effort. You can see that just by all of the public officials and community leaders lined up and others who can't be here. It is a big team effort. Team is working together very effectively and making great things happen. And I'm excited to have gotten the tour today. I've been talking with Pat and others for months following these developments, hearing about this great vision. And I wanted to put, boots on the ground and see directly exactly what was happening and meet some of the key players involved. I've been so impressed every step of the way that, number one, when Pat asked if my state director, David Doss, could be part of the sort of working group and advisory committee, I immediately said yes, because I wanted to be fully plugged into this effort. And then number two, as I developed our plan to hopefully lead the state as I'm running for governor, in the provisions where we talked about mental health, I specifically highlighted this exciting new project and vision and campus as a work in progress and a model that will not only flourish here, but hopefully that we can consider replicating in other regions of the state. That's what we need to do. We need to think outside the box, and we need to move the serious issue of mental health care out of the criminal justice system, where it's too often located, with folks falling through the cracks, and more properly address these very serious needs. We were talking inside, in many parishes of the state, the great majority, the biggest mental health provider, quote unquote, is the sheriff. That's ridiculous. That's not the right way to provide the services to folks in need that need those services, and it only burdens the sheriffs and law enforcement officers and the criminal justice system with all sorts of additional issues, and they have plenty enough on their plate in terms of violent crime and what is in their main wheelhouse. So that's why I think this new model, this exciting campus, it's a work in progress, but it already shows so much promise. That's why I'm so impressed and so excited to see it develop and possibly replicated in other regions of the state. So again, I'm here today to listen and learn. I've been following this progress for months, and I'll continue to do that and certainly provide any support we can, hopefully as I lead from the state level, and also look at this model for addressing our mental health needs around the state more fully. But thank you all for having me today.